Hello, everyone, and welcome to the 2022 Annual HMIS Data Quality Webinar for the Texas Balance of State CoC. My name is Gabrielle Garcia, and I will be getting us started today. I'm joined by 4 other members of the HMIS data team, Lindsay, Paula, Marissa, and Cosme. This webinar, for those of you who are newer to HMIS, is an annual webinar required by HUD where we go over some common data quality issues that we've found within our CoC. So today we're going to walk through some of those common data issues and also discuss how to fix them moving forward. But before we begin, let's all take a couple of seconds to put away any distractions that we have, like our phones, close out our email, finish up anything else that you're working on. We want to gently ask that you dedicate your time and your attention to this meeting so that we can all make good use of this time that we've carved out for each other. Since our goal is to house our clients as quickly and effectively as possible, we really want to make sure that everyone is up to date on best practices for data collection and data entry within HMIS. You might be wondering what data quality has to do with housing our clients more effectively, and we will dive into that in a bit. So let's take a look at our agenda. First up, we will talk about some quick housekeeping items, and then we'll dive into today's material, starting with why data quality matters. Then we'll discuss the system performance measures, or SPMS, and then our data team will dive into some common HMIS errors and show us how to best interact with HMIS tickets. Finally, we have some time saved for any questions you may have at the end of the webinar. But please do not hesitate to send out any questions in the chat box as they come. We have team members who are watching and ready to respond. So we only have a few housekeeping items today. First, I want to take a quick tour of Adobe for those of you who are new to the program. You'll see on the bottom right, you can download materials and files that we'll be using today. But before you download the presentation, I also wanted to say that today's webinar is being recorded, and we will upload this to YouTube and email you all a link so you can watch it again if you'd prefer that over downloading a slide deck. Above that, you'll see the chat box, which is here for you to type in any questions. And like I said before, we have a few THN staff members who will be answering questions in the chat box as we go. So please ask questions. There's no such thing as a bad question. If you're wondering it, chances are that someone else is too. Also, if you haven't already, if you have any coworkers who are not able to make it to the training, we will be putting this recording into Litmus and assigning it to folks later this week. If you are screen sharing with a coworker, please type your name into the chat box if you have not already, if you don't see your name in the list of participants on the right-hand side of the screen. A general rule of thumb is if we can't see your name, then we don't know that you attended. You can also email the HMIS team at hmis@thn.org, but it's probably easier for you to just type any screen shares into the chat box now. Lastly, if you are not an HMIS user, you do not need to stay in this webinar. I repeat, only active HMIS users who are currently able to log into HMIS need to be here today. Alrighty, we do have some questions for you before we dive into today's material. So please join us in, participate, and type in your answers into the chat box for some quick Q&A. So the first question that we have for you is, what city or town are you joining us from? Ooh, awesome. Actually, we have some Denton people, Abilene, Farmers Branch, DeBolie. I don't know if I'm even saying that right. Amazing. Thanks, Katie. San Antonio. Oh my gosh, thanks, guys. Wow, look at all of these cities coming in. McAllen, Temple, Lewis, Corpus, and I know I'm skipping a few. I'm so sorry. San Angelo, Houston, Beaumont, Sherman, Odessa, Waco, San Benito, Texarkana. Amazing. Harlingen, amazing. Orange, Texas, welcome. Tyler, Texas, amazing, guys. If you didn't know already, our CoC has 215 counties. So it's amazing to have maybe not all of us together, but a lot of us together in one space. So thank you so much for being here and participating and just, even just letting us know where you're tagging in from. It's great to see. If you didn't know, for me, myself, I'm here in Austin, Texas. So I see some of you guys out here too. We have one more question for you before we jump in. And this one's a little bit more. So we'll give you a couple extra seconds also. But my question to you is, what is your favorite part of your job? And I see some answers coming in. Helping change lives for the better, veterans helping others, lives changed, seeing clients smile, helping people, my team, improving the community, helping clients, helping others. Oh, there's definitely some trends happening here. Interacting with clients in the recovery program, helping others, working with clients, working from home, client interaction, making others feel more secure, attending webinars, thanks, love to see it, we appreciate it. Getting to work on social media, that's cool. Helping others, helping the community, helping people find homes, seeing people become self-sufficient, serving others and changing lives, data collecting for grants to bring more services, that's important work for sure. Amazing, guys. Thank you so much. Thank you all for sharing pieces of your stories. We talk a lot about data and everything else that goes into it, and it's great that we remember that there's always a bigger picture going into it and coming out of it. So we really appreciate you. Thank you so much for taking the time to share. And without further ado, let's dive into data quality. So as we just learned, our CoC is huge. 215 out of the 254 counties in the state of Texas. So that's all of the orange counties you see in this image. Fun fact, we are the second largest CoC in the United States, just after Alaska. So there are situations where our entire CoC's HMIS data is looked at as a whole by HUD, meaning that the data that you are entering into HMIS does not only reflect your agency or even just your community. So there are times where all 215 of our county's data is lumped in together and scored as one. So since our CoC is so large, all of us have to work together to make sure that our data quality is high and that we are avoiding data mistakes and fixing them as we go, because we're not robots. We're humans and humans make mistakes. So our job now is to reflect on that and learn how to fix them moving forward. So the first thing I wanted to talk about was the components of data quality. And the first overall concept we'll take a look at is completeness. This is a very straightforward component. Is the data complete or is it not? This can impact our work because without complete data, we don't have a complete picture of the needs of the community and whether or not there are any gaps in the system. We've seen instances of issues with data completeness at various agencies all across our CoC. We know that there's a ton of work being done in communities across the Texas Balance Estate, but if it's not documented in the HMIS system, then there's no way to account for it. For example, say an emergency shelter is actually serving 100 clients a month, but only 50 of them are being entered into HMIS. There's a huge data quality issue that will in part determine your program's effectiveness and or impact. So I wanted to pause for a second and see if there were any questions on data completeness. If there are any questions, please go ahead and type them in the chat box. We'll keep going. The next data quality component I wanted to go over with y'all is timeliness. Timeliness is so important when striving for accurate data. Data entered in a timely manner reduces human error that occurs when too much time has elapsed between data collection and data entry. It is so easy to forget exit dates, services, and referrals after just a few days, especially if you're working in a hectic or busy work environment, like I'm sure a lot of us do. So keeping that in mind, the sooner the data is entered, the better the chance the data will be correct. Timely data entry also ensures that the data is accessible when it is needed for monitoring purposes, meeting funder requirements, or even just responding to requests for information. Ideally, we will complete all data entry in electronic records at the time of service. So that means direct data entry. This helps reduce human error and also cuts down on paper usage. When we don't utilize direct data entry, we run the risk of being unable to ask any potential follow-up questions to clients that may have been exited or may have left the program. However, we do know that there are occasional circumstances that prevent us from doing direct data entry. So if you must do delayed data entry, it's incredibly important that all HMIS workflow questions are represented on your paper intake forms. And if you need any paper intake forms, we have those available for download on our website at thn.org. Are there any questions on timeliness or data completeness? Oh, and I see we did have one pop up in
Deborah,
the chat.
yeah. Yes. Deborah asked, what are the most common omissions that you see? And Lindsay replied,
awesome. We will definitely be covering that more, yes, coming up. Sit tight. We'll be there very soon. Thank you so much. And thanks, Lindsay. Thanks, Craig. So last bit on timeliness, in order to comply with reasonable quality standards, THN establishes the following policy regarding client record data entry. Emergency shelter, homelessness prevention, and rapid rehousing projects must all enter information within 1 business day. Coordinated entry, transitional housing, permanent supportive housing, outreach, and supportive services only must enter all information within 3 business days. So why does data quality matter? Quality data can affect you and others. Our rankings and success on reports submitted to HUD do affect our COC's funding, which affects the types of services as well as the amount of services that are available to the clients we serve. So it's in our best interest as well as our clients' best interest to keep our data quality high. We know that y'all work so hard and we really want that to be seen and ultimately recognized by HUD. These common data errors that we're going to talk about today are potentially creating more barriers for our clients as well as diminishing your hard work. We also want to create a system where all of our clients can navigate seamlessly through to permanent housing. Also, if we can use our data to help HUD paint an accurate picture of the problem and identify patterns of use, then we can better understand how to fully create a working solution to end homelessness. So switching gears a little bit, we're going to briefly talk about system performance measures, or as you most often hear it as, SPMs. I wanted to give a very brief refresher on what the specific measures are and what data elements are collected for measures because, as you've probably guessed, it all ties back to data quality. So HUD has developed the following 7-level performance measures to help communities gauge their progress in preventing and ending homelessness. Number 1, length of time persons remain homeless. Number 2, the extent to which persons who exit to permanent housing destinations return to homelessness. Number 3, number of homeless persons. Number 4, jobs and income growth for homeless persons in COC program funded projects. Number 5, number of persons who become homeless for the first time. We actually don't report on number 6, so I'm going to skip over it for today's purposes. And then number 7, successful housing placement. The purpose of these measures is to provide a more complete picture of how well a community is doing at preventing and ending homelessness. Measure 3, the number of homeless persons directly assesses a COC's progress toward eliminating homelessness by counting the number of people experiencing homelessness, both at a point in time and over the course of a year. The 6 other measures help communities understand how well they are at reducing the number of people who become homeless and helping people become quickly and stably housed. When analyzed, the performance measures are relative to each other and provide a more complete picture of a system's performance. For example, measure 1, the length of time homeless, encourages communities to quickly rehouse people, while measures on number 2, returns to homelessness, and number 7, successful housing placements, encourages communities to ensure that those placements are also stable. Taken together, these measures allow these communities to more comprehensively evaluate the factors that contribute to ending homelessness. For COCs to accurately assess their progress using these measures, they must ensure that their data is as complete and as accurate as possible, from data entry all the way to report generation. So my goal today isn't to break down each measure and go over the nuts and bolts. And if you want that, HUD has a lot of resources available for you. What I really want to focus on is how this all relates back to HMIS data. So each measure of the SPMs looks at a specific set of data elements from, you guessed it, the data that you enter into HMIS every day. However, the following data elements are used in the SPMs as a whole. So these are the 2022 data standards, their element numbers, and their element name. We have 2.04 project type, 2.05 method for tracking emergency shelter utilization, 2.06 federal partner programs and components, 3.03 date of birth, 3.10 project start date, 3.11 project exit date, 3.12 destination, 3.917A living situation, 3.20 housing move-in date, 4.02 income and sources. So you'll notice that these data points are not necessarily demographic data. And there are a few of those that you don't enter from your end, like project type, method for tracking emergency shelter utilization, and federal partner programs and components. Those are set up by the HMIS team on the back end. But if you have any questions about your own setup, please don't hesitate to get in touch with us and we'll take a look at what you have. So how does this all tie back to normal day-to-day HMIS entry? The SPM data is a reminder of all the hard work that you do, and often it shows some areas for improvement for all of us. Because we only work with SPMs during certain times of the year, it can be hard to remember that it's actually an ongoing process, and your normal day-to-day HMIS tasks and data entry all add up to something much bigger. You've probably heard us say this a million times by now, but the data that you put into the system matters. It directly affects the reports that we send to HUD, which in turn affects how we are scored as a COC as a whole, which then affects you as our agencies, and then ultimately impacts the clients that we serve and the services that they receive. Before we continue on, I wanted to pause again and see if there were any other questions. All right, guys, don't forget, if there are any questions that come up, please drop them into the chat box. And I'm sorry, Craig, did I interrupt you?
No, I was just going to say the
Awesome, great to go. All right, since there are no more questions, I'm going to hand it off to our HMIS data analyst, Cosbe.
Thank you. Good afternoon, everyone. We're now going to talk for a few minutes about duplicate clients in HMIS, why they are bad, how they get created, and how we can perform better searches to prevent the creation of duplicate clients. So first things first, what are duplicate clients? So duplicate clients are two client records in HMIS who represent the same client. The main reason these are accidentally created in HMIS is when someone does a search for a client and they don't do a thorough search. So they create a new client thinking the client is not in the system already. So how do duplicate clients affect HMIS? They basically make our client universe appear to be much larger than it actually is, which affects our numbers and all of the SPM metrics. This potentially affects the amount of services that are available for our clients and our communities. For example, System Performance Measure 5, which Gabriel spoke about earlier, looks at the amount of first-time homeless people in our system. When Client Track pulls the data for every new client within the reporting period, it is potentially making it look like we served more new clients than we actually did. So this number counts against us in terms of productivity on the SPMs. If we look at SPMs as a type of report card for our CoC, duplicate clients are essentially bringing us down a letter grade. So if we can avoid creating duplicate clients, we can avoid muddying our success. Not to mention, duplicate clients affect our clients' ability to access services and can potentially be a barrier to clients. So what can we do to avoid them? We really need your help with this. The data team is regularly merging duplicate clients, but we would love to stop them from being created altogether. You can help us with this by really taking a couple extra minutes to search for every client during intake. I'm going to walk through some examples to help you better understand the issue. But first, just in terms of searching for clients, the best way to prevent the creation of duplicate clients is by creating good search habits. So always start the intake process by searching for the client, even if you're confident that they're not an HMIS yet. Never go straight to the client intake button without searching under Find Client first. When you search broadly. There are many misspelled names in HMIS, and you should go into the search assuming that some of the data could be wrong. Ask the client also if they have ever had a name change. We see many duplicate clients that have a different last name due to marriage, divorce, transition. We can always edit a client's last name in HMIS, and we should never create an entirely new client record simply because their name changed. So when searching, always search more than once and always try searching using different fields. So if the client doesn't come up in the first search, pick 2 different fields and try searching again. Taking a few extra minutes to search for a client can save you time in the long run, because you'll see that you don't have to spend all that time entering data that already exists if the client is already in the system. And also later on, you won't have to submit a ticket to remove duplicate clients from HMIS. So what causes duplicate clients? One of the main reasons they get created is misspelled names, like I mentioned. We see hundreds of duplicated client records in the system that were created twice because someone misspelled the client's name the first time around. So when the second assessor searched for the client's name, nothing came up. I'm going to use a fake client as an example. So let's say that Maria Calhoun presents at an agency for services. However, the assessor who first enters Maria into HMIS is having a crazy busy day, maybe didn't hear her correctly or something, and misspells her name. So she's entered into HMIS as Mary Calhoun. A few months later, Maria presents at a second agency, and this assessor makes sure to get the correct spelling of the client's name. This second assessor then searches broadly in HMIS for the client's name using only the first few letters of her name, but because of the first assessor's typo in the client's last name, nothing comes up in the search. So the second assessor assumes that the client is not in the system and creates a new client record in HMIS, and now we have a duplicate. So how could the second assessor have found the misspelled client and avoided making a duplicate record? So let's take a moment to look at the information that's on the slide, and if you can think of a way, please put it in the chat. Yeah, all right. I'm seeing a lot of people coming in, and yeah, absolutely. As all of you have pointed out, the first and second assessors both got seemingly the correct birthday and social security number. So the second assessor could have searched using either of those fields and found the misspelled client. So please always take time to get all information correctly. Spelling, dates, social security number. Again, we almost need you to assume that there is potentially bad data and just aggressively search for your client. And most of the time, date of birth and social security, or at least the last four of the social security, is a pretty good safe bet. If you find a client in HMIS that has the wrong information, like in this case, you can always change that information instead of creating an entirely new record. But we really need to take a couple extra minutes to really look for that client so we don't have the amount of duplicates that we currently have. I also see a question that popped up in the chat. So now that we have these two HMIS numbers, which one do we keep, the new one or the old one? And I'll go into this in a little bit, but basically we're going to keep the one that seems to have the most data or the most correct data that we can tell. Um, and or if we get a ticket submitted and there's a preference, we can always go with that. But I'll explain that a little bit more in a minute. One thing that we've noticed a lot of our users doing also is searching for clients using this search bar at the top to search for clients instead of clicking the Find Clients icon on the left-hand menu panel. While this is okay if you know the client is in the system and you want to pull them up quickly, this is not the way to search to see if a client exists in the system. If you aren't sure if your client is in the system, this is not a good way to look for them. As you can see, there aren't multiple fields to search here. There's only the one. So in the last example, we wouldn't be able to find Maria using this search function. We would need to click the Find Client icon in order to make sure Maria isn't already in the system. So on the actual client search page, you'll see we have 7 different search fields to use to find our client. This is the page that you need to use if you're not sure that your client is in the system or if you're having trouble finding them in the system. So all in all, please don't ever search for a new client using the search bar and then give up and make a new record just because you don't see them there. Please always try searching using the Find Clients page first. And on a similar note, if you know that a client is supposed to be in HMIS, for example, if it's a client you've enrolled in a program or referred to a different service, but you cannot find them, it's possible that the client was merged with a duplicate, and that's why you are unable to locate them in the system. By using the Find Clients page, you can search for them using other information you might have. If you still cannot find them, please reach out to the HMIS help desk and we can help you locate their new client ID. It's really important that, like before, you don't create a new client from scratch just because they look like they're gone from the system. So let's talk for a minute also about the release of information, or ROI, the clients has signed and how it relates to client searches. There may be many times when you do a search and you find duplicate clients in the system. You submit a ticket through HMIS and ask us to merge the clients, and then you hear back from us that we cannot merge the clients because one of the clients has a release of information set at restrict to organization. If the client fills out their ROI indicating that they do not want to share their data with other organizations in HMIS, the person entering the client sends the client's ROI to restrict to organization, which is correct. So when a client has an ROI of restrict to organization, that means only people who belong to that organization can see the client. Because of this, if a client presents at a different organization for services, there will be duplicate clients created because they cannot see or access the existing client. It is important to note that we cannot merge a client where one of the clients has an ROI of restrict to organization unless both of the clients were created by the same organization. And so finally, what to do with duplicates. This is going back to that same question as well that popped up in the chat. So what do we do with duplicates? If you search for a client during intake and you find that they already are in HMIS, but the record includes incorrect data, you should confirm that it's the same person and then click that Edit Client button to change the bad information to reflect correct data. If you find two duplicate client records in HMIS that are definitely the same client, please send them to the data team to be merged by submitting a ticket through HMIS. And please make sure to include both client ID numbers. When we merge clients, all the enrollment services, case notes, assessments, all of that is transferred from one ID to the other, and then that other ID is discarded. So if there's a client ID that you would prefer to keep, let us know which one, and we'll do our best to accommodate that. Otherwise, we will usually keep the one client ID that has the most complete information. It is also important to note that the family relationships will be maintained only with the client ID that is kept. So just to kind of recap, spending a little extra time when searching for a client can save everyone time in the long run. And it will also ensure that the numbers getting reported are an accurate reflection of who is being served within our system. So just very quickly, I want to pause to see if there are any questions. All right, so if there are any questions, please make sure to put them in the chat and we'll get to them. But just for the sake of time, we're going to move on, and Paula is going to talk about program enrollments.
Thank you, Cosme. Okay, so for the next few minutes, I'm going to talk about some of the best practices for removing or adding family members from a household and the differences between the family members in a household and the family members in an enrollment. So there is a difference between a general household and an enrollment household. You will see in a few minutes when I do the demo on enrollments that it will show you all the family members currently in the general household and give you the option to enroll them at that point. You can enroll all or some of the family members at the time of enrollment. It may be that you are doing an emergency shelter enrollment and one of the family members is not staying at the shelter that night. While they're still part of the family and they shouldn't be removed from the family, they just wouldn't be included in that enrollment. I will show you during the enrollment demo the difference between the family page, which shows you all the general household members, and the enrollment page, which is where you actually include them in that enrollment. But first, let's talk a little bit about why you would add or remove someone from a family. You should add someone to a household if the family composition has changed. So for example, you would want to add a family member in a case where a baby was born, or if another family member moves in and joins your agency's project. It could be someone got married. Some examples of when you would want to remove a family member are if someone who was part of the family moves to another town or state, or if a couple is no longer together and are receiving services from separate programs or agencies. Because there are a lot of issues that can come up when removing a family member, We ask that if you need to remove a family member, please submit an HMIS ticket and we can make sure that none of those bad things happen with removing a family member. Also, please don't ever just create a new client because they're no longer part of a family, because that would be creating a duplicate client. So if you submit a ticket to us, we can have them removed from the family, and then you'll be able to have them in a separate family and you can do any enrollments there. Set a review. Please never remove someone from a family. It's very easy to cause issues when you do this. Always submit a ticket to HMIS if you need a family member removed. Add a family member if the family composition has changed and they will be receiving services. And you don't have to remove a family member to exclude them from an enrollment. You just wouldn't enroll that family member, and I'll show you that in a few minutes. So before we go into the demo, I wanted to emphasize the data collected during the enrollment process is very important for accurate reporting. If you do not enter complete and accurate data, it could have impacts on future funding for our COC. It can also cause issues with effectiveness and planning, as you aren't getting a true picture of what is happening in your area. There are assessments created throughout the enrollment process. So if you do not complete the enrollment workflow, you will have missing assessments, which can cause issues with reporting and having accurate data on your client. So it is important that you complete both the entry and exit workflows all the way through until you see the finish button. Now I'm going to do a quick demo in Client Track on how to create an intake and point out a few things that are happening automatically and also a few things that trip some people up. And as we go through the enrollment process, where places where we have confusion, I'll kind of try and point those out. And we will ask you a few questions along the way, and you can type those answers in the chat. Craig, I think you need to change the room.
Sorry, I'm just looking at.
That's okay. Okay, can y'all see my screen?
We are seeing Client Track.
Okay. So the first thing I'm going to do is I'm going to go to this Find Client button that we just heard a lot about, and I'm going to search for my client. And in this instance, I have put in their full first name, full last name, social security number, and birth date. And I hit search and I get no records found. And the reason for that is because, as Cosme pointed out, if any one of these things is off, they all have to match exactly or it's not going to find my client. So let's say that happens and there's nobody in there. What I would want to do then is maybe just put the last four of their social and the first few letters of their first name. And when I do that, I get this client. I could even just put the first few letters of their first name. And when you do that, you'll get like the full list. And you can see like, oh, you could easily see, oh, this person is the same person. So then I select my client. And this client actually already has a rapid rehousing enrollment, but we're going to be enrolling them in our emergency shelter because they're going to be staying in our emergency shelter tonight. So from here, I go to the intake and I'm going to use the current client because I already found the client. This information is all going to auto-populate because the client already exists. So that's one of the good things about finding the client that already exists is I don't have to re-enter. When you're creating duplicate clients, you're re-entering all of this data over again. So on this page, all of that's good. So I'm just going to click finish. And now this is the family members page that I talked about. So this page does not tell you who is enrolled in this enrollment. It simply tells you these are all of the family members that this client has. Another place, like just on the main dashboard screen, I know some people don't know this, but you can always click right here with the two little people and it will also show you all of the family members. but this is just a family members page, doesn't have anything to do with enrollment. So I'm not going to touch anything here unless I need to add a family member. So if I was wanting to add a family member, I could type their information in here with and it's going to do a search and say, does this person already exist? But for my instance, this person doesn't exist. I could also broaden this search a little bit if, for example, do that, and then I would get a list. And if that person did exist, I could select them. But if I find that they don't exist, nothing comes up. I hit cancel. And then I enter the rest of the information. So, and it's kind of different here because it's vertical. So you have to go across and fill in all the fields going across. And I want to show you right here, if you'll see under gender, it's not an actual field. It's just these very tiny little 3 dots. You do have to select something though. And if you don't, you select it and then you click your check mark. If you don't, it'll give you an error. You choose the relationship to the head of household. And some of these fields depend on age and that type of thing too. So now I'm going to click save. And I get this error message up here that says there's one row in the result set that requires attention. If you get that error message when you're trying to enter somebody, if you go to the person and you click right here, it'll tell you what the issue is. So this is saying this may be a duplicate client because the client has the same social as other people. And that's because I'm in the training system and a lot of people just type in random numbers. Oh, and actually I didn't even type in all 4 numbers. Oh. So when I correct it, my error message goes away and I click save and close to go to the next page. So now I've added that person to the family, but I haven't enrolled anybody in this project yet. So next I'm going to enroll them in the actual project. So we're going to do an emergency shelter enrollment. And let's say that it's just this person. Maybe the kids are staying somewhere else, or this isn't a family shelter for whatever reason, only this person is being enrolled. The fact that I just have a check mark next to him and I only have a project start date next to them, they are the only ones that are going to be included in this enrollment. So when I save this, this would only enroll this one person in the enrollment. So for us, we're going to go ahead and enroll 2 people. So these 2 people are the only ones that are staying at the shelter this particular day. So I click the save button. And then I get to all of the pages where I have to enter that y'all are very familiar with during the intake process. So disabling condition, when you have multiple family members, as you know, it goes through the head of household, which you should always start with your head of household. It goes through the questions for them first, and then it'll switch. You'll see it switch to the child or other family member. So you can choose whether or not they have a disabling condition. The client location should always be Texas balance of state. Prior living situation, and this should be based off of basically where they were staying, as it says here, the night before program admission. So where did you stay last night? Length of stay in prior living situation. So that's how long were you staying in the place you stayed last night. And then this one always seems to cause a little bit of confusion, but approximate date homelessness started is based on this instance of homelessness. So if this person has been homeless multiple times, you don't want to go back to when was the first time you were ever homeless. It's when was this instance of homelessness started. And you would put that date in here. So let's say it's been a week this time. And then regardless of where you stayed last night, the number of times you've been homeless, and then the total number of months in the past 3 years. So you fill out all that information. If they have health insurance, you select yes and you enter their health insurance. If they don't, you select no. And then on this page, we're just going to save again. And then this is going to take you to the barriers page. You'll notice disabling condition is actually selected on a prior screen, so it already comes in filled in. And then you have whether or not they have disabling conditions, and you can select or deselect them here. Then you get to the domestic violence assessment, which is really just one question. Yes, no, or the client doesn't know, refused, or data not collected. And we're going to save that. And then we get to the income and the non-cash benefits from any source pages. And I know y'all have all enrolled and exited folks from these various programs. This really matters that this is being captured correctly because it is looked at in some of the reporting. So they look at the income and the non-cash benefits from both the entry and the exit to see if there was an increase or decrease in those numbers. So if you do select yes, you do have to select something down here. You need to put the dollar amount that they indicate to you that they are receiving monthly from that income source. You can put as many as they have in here. And then we save and close. So because I am doing an emergency shelter check-in, the next thing I get is the check-in to check them into the facility. So I select the facility and it's going to show all the facilities that are set up for my organization. I select the room and I select the bed. Make sure that the check-in date is correct, especially if you're doing backdated entry. This needs to be the same as the enrollment date. And then down here, we select the enrollment. And then we save. And now you'll notice we're back to the universal data assessment, but now we're filling it out for the child. And it always will switch up here and tell you who you're entering that information for. So it's kind of easy to tell. And it also shows it right here. So there won't be quite as many questions since this is, I think I made this a child. The disabling condition, it's going to bring in the information if it was already in there. So we would only need to change something here if something was different, which it could be. And now we're going to check them into the facility. You click and you notice now that there's only one bed available here. That's because someone's already checked into that other bed. So now this is telling me this is the only one that's left that you can choose in this facility. And then I choose once again the enrollment. And we save. And this is the screen everybody wants to see. If you stop an enrollment before you get to this screen, you did not complete all of the data you needed to enter for that enrollment. And then you have incomplete data on possibly both of the people, depending on where you stopped. So you always want to keep going through all the pages and saving until you get to this finish, close the workflow. And now you'll see that I have this emergency shelter enrollment with 2 active household members. You can see the project start date. You can see the number of days enrolled and when the last assessment was, which was today. So this is all of the client's enrollments. And I want to show you real quick the assessments. And so this is under the assessments menu. If you click on master assessments, You'll see here that I have two entry assessments, one for the rapid rehousing enrollment and one for the emergency shelter enrollment. You should always have an entry assessment that goes along with the enrollment. The only reason you would not have that is if you did not complete that workflow. So now it's quiz time. So when looking at the assessments, this entry assessment is created when you complete a certain page of the workflow. So it's automatically created when you complete that certain page of the workflow. So if anyone can type in the chat, and I actually can't see the chat, but which page of the workflow creates the entry assessment? And if one of my teammates could read if things are coming into the chat.
So far we've got some folks typing. No one's answered it just yet, but I'll let you know.
Okay, thank you.
So one of those pages of the intake workflow automatically creates that entry assessment when you finish that page. So what page of the intake workflow creates that entry assessment? No wrong or no bad answers. There might be some wrong answers, but they're not going to be bad ones.
And I'm just going to show y'all real quick too some of the other assessments that are created when you do that intake. So if I click here and say view the related assessments.
Paula, we got some answers in.
Assessments that have.
Sorry to interrupt you.
Hey.
We got one person said
That's okay.
assessments, which is very close, and then Joy said universal data. So it looks like Joy got it right. It's that universal data assessment page. Good.
Yep. So once you complete that universal data assessment page, it creates this whole entry assessment. And then as you're going through some of those other pages, like if I click here on the HMIS barriers page, or assessment, you're going to recognize that like this was the barriers assessment you were completing. So even though you may not know you're completing assessments, as you go through that intake process, there are assessments being created, and a lot of the reporting comes from these assessments. So one thing I wanted to go over real quick is the housing move-in date. So this client down here has both a rapid rehousing and an emergency shelter enrollment, which is possible, right? You might be trying to find them housing. You haven't been able to get housing yet for them, so they're staying in your shelter tonight. But let's say that now we have found housing for this client. So they are going to get to move into this housing. It is very important. You'll see here that it says housing moving date and it's empty. It is really important that when a client moves into housing, you go back into their enrollment and enter their housing move-in date. As far as HUD is concerned, if there is no housing move-in date, they have not moved into housing and they are not housed. So this person, looking at it from a reporting standpoint, would still be considered homeless. So to enter the housing moving date, you find the enrollment for the client, you click the blue action button, you say edit project entry workflow. You're going to have to kind of skip through the first couple of pages. Well, my page isn't even coming up. There we go. It's being a little bit slow. So you would skip through this first page, which has the basic client information, and just click no changes on that one. We're going to skip through that family member page and just say save and close, no changes on that one. And then when we get here to the enrollment page, you'll notice this field right here. And it's only on the head of household. So even though there's 2 people enrolled in this, you only enter the housing move-in date on the head of household. So let's say tomorrow is the first night this client is going to be staying in his new housing. So we enter a housing move-in date, we save it. And then we just skip through the rest of the pages by saying no changes, save and close, no changes. Because we don't need to change anything else on any of these other pages. Well, I don't know. Well, I am going to have to change this because I apparently did not fill it out when I created this enrollment. And then back to the finish, and we click that finish button, and we're done. So now we've added their housing move-in date. We wouldn't want to exit them from the project until we're no longer assisting them. So this shows that they were enrolled on 5/10/2022. We got them housed in 8 days, and then we'll go through project exit in a minute and when it's appropriate to do that. And now if you can switch back to the slide deck. All right. So now I'm going to talk a little bit about exiting enrollments, what the exit destination is and why exiting your clients is so important, and how to choose the right exit destination. So first, we've noticed that a lot of users aren't exiting their clients from their programs, especially for our emergency shelter and street outreach programs. And I really can't stress enough how important this issue is for data quality. It is very important that if you have a client no longer staying at your shelter or that's no longer in your program, that you exit them from your program. So when should you exit your client from emergency shelters? First and foremost, if your client leaves the facility, exit them. And be sure to also check them out of a bed if you had them checked into a bed. If they return within the week or 7 days, you can re-enroll them using the blue action button next to their enrollment and selecting re-enter the enrollment option. And if your client returns more than 7 days later to your facility, then you should create a completely new intake or program enrollment for them. It's important to know that if you don't check your clients out of the beds and exit them from the program when they are no longer staying at your facility, if they present at a different facility, and some of y'all may have had this happen where you're trying to enter someone into your emergency shelter and the system says you cannot do it because they are already in another emergency shelter. That is 99.99% of the time caused by the fact that they weren't checked out of a bed and exited from a shelter that they left. So please be very careful and make sure to try and stay on top of getting them exited. So what about for street outreach? So this one is a little bit more complicated as your clients don't necessarily leave from a street outreach program. So you would exit a client from street outreach if your client has entered another project type, for example, transitional housing or permanent supportive housing, or if they've found housing on their own. If the client is engaged with another outreach worker or case manager, or if the client has passed away. And finally, if you or your outreach team has been unable to locate the client for an extended period of time and there are no recorded contacts, which is typically between 30 and 90 days. And that's really up to your agency to decide, like, what is our time frame where we're going to say, if we haven't had any contact with this person in this number of days, then they need to go ahead and be exited.
Hey, Paula, sorry
you've
to
had some
jump in on you again. Oh, thanks, Craig.
Yeah.
We got a couple questions. Kelly Stallings asked, and I think this was on the previous slide. So Kelly, I might ask you to put a little bit more information about what your question was in regards to. But Kelly said, in that instance, what would we do? I think this might be about if someone was checked into another shelter already. Is that right, Kelly? Oh, if a client is already enrolled at another agency, yes. So I think Kelly's asking
Okay.
if they're checked into another shelter, what would they do in that situation?
So the best thing to do is if you have a contact at that shelter, is to reach out to them and let them know that they need to exit somebody. If you don't have a contact at that shelter, or you cannot access anyone at that shelter, you can submit an HMIS ticket to us and we can help you with it.
Yeah, so just let us know, hey, I need to enroll this client. I need to check this client into a bed. That's the only part that you're not going to be able to do is the bed check-in piece. And we can get in touch with that other shelter and make sure they exit that client. And then Sharon asked, is there an easy way to list the clients that are listed in the shelter? In other words, I want to perform an audit to make sure only current clients are enrolled or listed.
It depends on where you mean listed. Like if you wanted to see clients that were, it would probably take a couple different reports. You could run the clients and programs report and get the list of all of the enrollments. And then in the housing workspace, I can't remember the exact name of the report in the housing workspace, but you could get the list of everyone who was checked in and kind of look at them against each other. I'm not sure if that's what you're asking, but.
And it looks like Sharon's typing, so I'll let you know what that response is since you can't see the chat.
I actually can see it now.
Oh, perfect.
I just wasn't paying attention to it. I can't see it when I'm doing the demo, but I can see it.
Gotcha. Okay, perfect. So it sounds like Sharon just wants to make sure that they've exited everyone from enrollments that needs to be exited and that only active people are still actively enrolled is what I'm hearing.
Okay. Yeah, thank you, Elena. Yeah, I think the clients and programs report will give you that, and then seeing who's checked into the beds. Miguel, Matt.
And then I think Estella had one that was a little further up in the chat that we haven't addressed yet. Ah, yes. So Stella said, I have had many occasions where they are not exited from the bed. So I contact the agency and they tell me they are exited, but they are still in a bed. So kind of like we said before, either, you can, if it's easier for us to kind of be the middle person in that situation, we're happy to do that, where we can, contact that other shelter and let them know they need to check that client out of the bed so that they can be checked in elsewhere.
Yeah, it's important to know that just because somebody's exited from an enrollment doesn't necessarily mean they checked them out of the bed. And both of those things need to be done. So what they're probably looking at is they're exited from the enrollment, but they're not checking them out of the beds. And we can help them too if they need some assistance in where to go to do that. So Miguel, do you mean the exit process? And if that's what you mean, why do we have to go through the whole exit assessments if they're no longer being helped? It's because there is reporting based on it that looks at, their exit destination. Like, is it a successful destination? Were they permanently housed? Did their salary or non-cash benefits increase? So those things are looked at to try to make decisions on where we need to do things maybe differently. So that's why all that data is collected, both at entry and at exit. Yeah, not exiting clients is definitely something that we see a lot, and we really do need to be exiting those clients. And otherwise, also, it looks like they've been enrolled in your program for 400 days when that's not, in fact, what is really happening.
And Paula, sorry to interrupt
Okay.
you one last time. Hopefully this is the last time I jump in on you, but just to do a time check, we have about 25 minutes left. And I did just want to echo what you said, that, you know, going back to what Gabrielle said earlier about SPMs and those larger reports that we submit to HUD as a CoC as a whole, you know, one of those SPMs that we look at is length of time homeless. So if someone is staying enrolled in a project for, you know, let's say a year when they actually were really only should have been enrolled for a couple months, that's going to affect our entire CoC's data and how we're scored as a whole. So these exiting enrollments are a huge piece of this data quality puzzle.
Definitely. And since we're running low on time, I am going to go forward and we'll come back around and answer the additional questions that are coming in. So I want to talk a minute about exit destinations, and this is one of the things that's looked at. So to start off, I want to go over some of the options under the other category. No exit interview completed. This option should only be chosen when that is the case. For example, if they disappear, if they leave without your knowledge, like they just are gone. This option is the least helpful in terms of data collection, so please only choose this option when necessary. Choosing this option does count as a negative, but if it's the truth, it's important to capture it. So if they really did just disappear and you can't find them, that is the correct thing to put. I also want to take time to note that no agency will ever have perfect data, so it's okay if you do have to choose this option, and it is what you should choose if that is indeed what happened. Now I'm going to talk about other. According to HUD, this option should only be used as a last resort if the client's destination truly cannot be even loosely described by any of the other options. And if you do select the option of other destination, a text box is going to pop up and require you to fill it out. In this text box, please be descriptive. Writing things like moved out of state or got a job isn't a housing destination and doesn't give us destination information. So when you're filling in that box, if you select other, please make sure you're writing where the client went and not why they left. The next is data not collected. This option is not interchangeable with no interview completed. Data not collected means that you as a case manager didn't even try to collect the necessary information. And it equates to a null or missing data on reports. So it does count negatively on reports. And when choosing an exit destination, try to fix the option that most loosely fits your client's destination. So if any of these are even kind of close to where they're going, that's the one you want to choose rather than choosing other. If there's absolutely nothing in here that's anywhere close to where they're going, would be the only time you would want to choose other. So now I'm going to do a quick demo on exiting clients. And this one's going to be faster than the other one because so many of the screens, as you already know, are the same. So we're going to exit this client from the emergency shelter because, hey, they got housing through their rapid rehousing. They don't need to stay here anymore. So I click on the blue action button and I go down to exit the enrollment. I've got the exit date. I've got the exit destination we were just talking about. So I try to find something that most closely fits where they're going. This is also important to pick the correct thing, because if you just choose the easiest or the top thing, it can look like they immediately return to homeless list, or it can cause things to look not what is actually happening. And then I go down here. I can add a last service if I have one that I haven't added. We can save that. And then this is basically going to take you through those same assessments. So it's just kind of looking to see, did anything change? Like, do they have health coverage now when they didn't before? Or did their income increase? Or has anything changed in their situation? So here, the income from any source. non-cash benefits from any source. Maybe they don't have any income anymore. And then this is the old check-in, check-out page. And I think this is when a lot of people click this skip button. So they exit them, but they don't actually check them out. So I'm going to click here and say edit check-in. And right below the check-in date is a checkout date. And I'm going to enter the checkout date for this client. And that is going to check them out of the bed. So it's part of the exit workflow, the checkout, but you have to actually click that button, edit check-in, and enter that checkout date. So now we won't have a problem with this person not being able to get into another shelter. So, and then it's going to ask me, do you want to exit any other family members? So we'll step through every family member. You pretty much always, 99% of the time, say yes here because you're almost always exiting them all at the same time. If you say no there, you're going to leave a family member enrolled. So you choose the same things. Add services if you have any. You usually add the services on the head of household. And then covered by health insurance, yes or no. The disabling condition, this is going to pull in what was there before. So if nothing's changed, you can just save and close. And then I'm going to check them out. And save that page. And then we get to the finish button and we're going to click finish. All right. So now this client is exited from the project. And if I go over here, and this is someplace where you can go look and see if a client is checked into a bed or not, because you can't really see it from here. But if you go to the housing menu and you click check-in history, you can see that this client was checked in and checked out. You can also check them out from right here. So if you exited them and forgot to check them out of a bed and someone calls you and says, this person is checked into a bed, we can't check them in, go to check-in history, click the edit check-in, and just enter the checkout date. And then you'll be good to go. And one other quick thing I wanted to go over is, let's say that I had a service for this person that I forgot to enter when they were enrolled. You can still add a service to that client. So I can go to Enrollments and Services and click Services and add a new service. However, you have to change this date first. So you want to change this date to be between the enrollment date and the exit date. And you have to do that first, because otherwise, if you have a date in here that's after the exit date, it may not give you the enrollment you're looking for. So this date drives the enrollment. So change your date first, then choose your enrollment if you're backdating to one that's already been exited. You don't want to choose a grant most of the time. For most people, we don't have services tied to grants. So you would just leave that blank and then select your service and save it. And now I am going to turn it over to Marissa.
Thanks, Paula. I'm going to go ahead and go over annual assessments and what errors missing annuals can cause on reporting. One of the largest data quality issues we see in our COC's data is missing annual assessments. Annual assessments are required for every client that is enrolled in your program for over 1 calendar year, even if there have been no changes to the client's information. So if your client has been enrolled for 3 years, we should see 3 annual assessments. That's 1 every 365 days. If possible, we should do those exactly on the anniversary date. However, if that's not possible, it is acceptable to create the annual assessment either 30 days before the enrollment anniversary or 30 days after the enrollment anniversary. If we fail to do this for a client, it will show up as an error on reports that are submitted to HUD. So to avoid creating issues on reports, we really need to make sure that we are doing this for all of our clients every year. One thing to note is that annual assessments are based solely on the head of household's enrollment anniversary date. If this sounds challenging to keep up with, try to create a system that works best for you and that can help you keep track of this. Perhaps you can put your client's anniversary date in a calendar as a reminder of when to do annual assessments. Now let's take a look at an example in the right column. Client A was enrolled in your program on June 1st, 2020. Ideally, they will have an annual assessment done on June 1st, 2021. However, since you are allowed to complete an annual assessment 30 days prior or 30 days after your client's enrollment anniversary, the window would be May 1st through June 30th. So now let's look at common reporting errors related to annual assessments. When a client is missing their annual assessment, we will get the error missing annual when we run the APR. This is caused by either a client with no annual assessment whatsoever, or the date of their annual assessment does not fall within the 30 days before or after deadline. To correct this, we would need to identify the enrollment that is missing the annual assessment and see if you can contact the client to fill this information in. Okay, so now I'm going to move on to talk about some common tickets / questions that the HMIS team gets asked. First, deleting enrollments and when it's actually appropriate to delete a client's enrollment. Deleting a client's enrollment should not occur for the following reasons. When a client leaves your program early or midway through, this means when a client moves out of state, finds housing through friends or family, self-resolves, or just doesn't want help through your program anymore. This is because it is important we record all your data, even if that data is not seen as successful. The work you do as case managers put into helping the client is important, and we want to make sure that all your hard work is seen and documented. Now, let's talk about when it's okay to delete an enrollment. So if a client ends up being ineligible for your program or services, a client never received services or case management, or when a client enters and leaves your program the same day. That means they didn't stay through the night. Basically, a good rule of thumb is that did you put in time, effort, and work to help assist your client? If the answer is yes, the enrollment should stay, and it should be exited with the appropriate exit destination and reason. The next common ticket is asking us to delete clients from HMIS. If the client is duplicated in our system, we will always merge the two client IDs together. We will never delete a client from our system, especially if one of those IDs has data attached to it. Also, when you find a client ID that is duplicated, please send us both the IDs. This helps us save a lot of time asking for the other ID or searching for the duplicate within our system. Next, I'm going to go over interacting with your HMIS tickets. So now let's talk about how to submit your tickets, how to respond to them, and how to attach screenshots. Where do you go to find your submitted tickets? To find your submitted tickets, you will need to be on the home workspace, and you can tell what workspace you are by looking in the top left-hand corner and seeing the header read Home, and going under the header titled My Client Track and selecting the option that reads My Submitted Issues. This will take you to a list of all tickets that you have submitted. Here you can see our responses to your tickets and any follow-up questions that we may have asked you. We frequently don't get enough information in submitted tickets, and it takes a lot of time to go back and forth and ask follow-up questions. So please always add in as much detail in your initial ticket as you can. For example, if a report is erroring out, which report is it? What is the time frame that you're running the report for? And what programs are you running the report for? Adding in detail will save us both a lot of time in getting you an accurate response to your question. How to respond to your submitted tickets if necessary. So once you navigate to your submitted tickets list, you can then click on any of the tickets and either write a follow-up response or respond to the ticket we assigned back to you by clicking the New Note button at the bottom of the screen. Then from there, you can write up your response and select one of the 4 options listed in the second image. Most users just select that first option that reads Save the Note. This will then alert the HMIS team that we have a new response waiting for us in your ticket. How to attach a photo to a ticket. Sometimes we get tickets saying that the workflow isn't saving information or that there are error messages popping up at the top of your screen, etc. In cases like this, it's really important to be as specific as possible and attach screenshots of your screen of the error when necessary. This will help us understand the exact issue you are facing in the system. So to attach a photo to a new ticket, you would select the option that reads, "Click here to attach a file," or drag and drop. This allows you to take a screenshot of something that you are seeing on your end and attach it to the ticket so that we can see what is going on to give us a better understanding of the issue that you are dealing with. That's all for tickets, and now we're going to leave some time for some questions. If anyone has any lingering questions, please feel free to comment them in the chat. Know that you can always send us a help desk ticket or send us an email directly at hmis@thn.org. Thank you all again so much for all your time and for your continued support. We're excited to continue working together to best serve our communities.
Thanks, everyone. So like Marissa said, we're going to stay on for the next couple of minutes and see if any last minute questions come through. But thanks for being here today. We appreciate y'all's time. And yeah, please email us with any questions. All right, I see a question from Miguel about why can we not run a report with the client's name with their HMIS number? I'm not sure, Paula, if you I'm not sure if I understand the question. I'll say that, and maybe Paula, you do, and you can hop in. But Miguel, I might need a little bit more information about what kind of report you want to run. Are you just asking why we can't run a report for each client? I see a couple other folks still typing.
Yeah, I would. Like, whenever I'm up there. Which report are you running, Miguel? And I will tell you this, in some cases, with a lot of the reports, it depends on how you export them. A lot of times, if you export them to Excel, and if you don't see that option, let us know and we can help with that. But a lot of times, there's a lot more data when you export them to Excel than when you export them to other formats. But if you can let us know like exactly which report you're running and what you're wanting to see, we can see if there's something that would give you that.
All right, y'all, we are running out of time. I see there's still a couple folks typing. Feel free to get any last second questions in. But otherwise, if you have any questions, please feel free to email us at hmis@thn.org, and we will follow up with you as soon as we can. Looks like that might be it. So I think it's safe to end it 1 minute early. Perfect timing. So yes, please reach out to us with any other questions you have. And I hope everyone has a great afternoon. And thanks again for your time today.
Thanks, everyone.